Hi, family and friends. Welcome back to the third presentation, the last presentation in the first annual Berean Word Women's Health Ministry series. The next presenter is a nurse with over 30 years of experience. Miss Dana Merritt is going to tell us how to prevent things like hypertension, diabetes, high cholesterol. So sit back, relax, and get a little bit more information on how to live an overall healthy life.
And I really am, I felt so graced and blessed by Sister Toya asking me to do this, because I have been a nurse for 30 years and my mom 40 years. So she was my inspiration. She was. She was the reason why I went to nursing school. Graduated from St. Louis Community College in '95. And I had a son in college when I was in nursing school, so I had to take a semester out. So I'm just saying that to say that a lot of times, I don't see a whole lot of people who might be interested in going back to school, but we can't let the kids stop us.
Right.
We got to keep it moving.
That's right.
Okay?
That's right.
And so I finished. I got a bachelor's degree at UMSL.
All right.
I had 3 kids at that time. I think I was pregnant with Chammy going for my bachelor's degree. So I didn't let kids stop me. Master's degree in 2004. No, 2014. 2014. From Barnes Jewish College of Nursing. Yes. So I worked at Barnes Jewish. I worked at Metropolitan Psychiatric Center, so I got some psych experience. I worked on high-risk cardiology. And so I've had a lot of experience with a lot of different patients. And so now I'm teaching. Now I'm teaching at St. Louis Community College at Forest Park. So I enjoy teaching. I think I should have did that a long time ago, chose that path. But God always has other plans. But I'm glad I'm here. I love teaching. I think it's my passion. You know, when we say that when you go to work and if you love what you do, you never go to work a day in your life.
Right.
And that's the way I feel. I can just go for free. They don't have to pay me, but I'll take the money. So I was asked to talk about health, our overall health, and how we should. So I labeled it "Love Your Temple," because God blessed us with these bodies.
Yes, He did.
And we come into this world with these perfect bodies, but as we continue through this journey called life, we start abusing it with the choices that we make. And a lot of times they're imposed abuses, like with our jobs we choose. They can cause stress. And then when we're trying to work, we might not always eat properly. So it's just part of the journey, but we really have to be mindful. And that's why I labeled this, "Love Your Temple, Take Care of Your Health." So you can go to the next slide. So I'll be talking about diabetes, hypertension, cholesterol, and how we can prevent all of these, and also try to reverse the effects of the choices we make. So what is diabetes?
They call it sugar.
They call it sugar. Yeah, I put sugar. Yes. There's 2 different types though. There's type 1 diabetes. Now type 1 is usually people who were born with it. Okay? And so their pancreas does not secrete any insulin at all. So they have to be on insulin for the rest of their lives to help control their diabetes. Okay. Next slide is type 2. Now, when Pastor said pre-diabetic, this is where we fall into, where our body, it doesn't secrete enough insulin properly. So we're at risk for developing type 2 diabetes. So the reason why this happens is that over time our bodies they get kind of fatigued because of how we're eating, right? So when we say pre-diabetic, we really need to make sure we are following what the doctors say and what I'm going to talk about. There's also gestational diabetes. So some women, when they're pregnant, they may end up being diagnosed with gestational diabetes. It said it affects 9% of pregnancies in the U.S. But about 50% of the women who's diagnosed with gestational diabetes, they will develop type 2 diabetes. So if they're not careful. Warning signs of diabetes. So if clients who say that they have urinating often, so they're constantly voiding, going to the bathroom, urinating, they feel thirsty, so they're drinking a lot of water. They feel very hungry or they're not ever full. They're extremely fatigued though. Blurred vision. They may have cuts and bruises that won't heal or they're slow to heal. They have weight loss. So with type 1 diabetes, they'll have a lot of weight loss. Numbness and tingling in their extremities, hands and feet with type 2 diabetes. So by the numbers, so when you go to the doctor and they draw blood, because we know that a lot of the illnesses are diagnosed through blood draws and lab tests. So the one lab test that they will look for when you're diabetic is the hemoglobin A1C. So you really need to know what your hemoglobin A1C is. It should be between 4% and 5 to 0.6%. An A1C that's between 5.7 to 6.4, that's us, Pastor, pre-diabetes. Okay. A level that's 6.5 and over, you are diabetic. So it can vary though, based on your age, what your diabetes, what your A1C status is. So you really need to find out that information when you visit your provider. Okay. What your hemoglobin A1C is. Also, fasting blood glucose. So sometimes the doctor may order a fasting blood glucose. So they'll tell you not to eat before you go to the doctor and get your blood drawn. And then they'll check your fasting blood glucose or your hemoglobin A1C. So in this case, we're talking about when they do the finger sticks. So how many of you know that people with diabetes, they have to have a finger stick, before meals, and it's fasting, before they eat anything. So what your blood glucose should be before you eat is 70 to 99 milligrams per deciliter. That's what it should be. But after we eat food, it goes up. So that's why we have to take that number before you eat. So 2 hours after you eat, it should be less than 140. 2 hours after you eat, okay? And then randomly, like let's say any time of the day, whether you eat or not, it should be less than 200. That's considered normal. Okay. So people with diabetes, if they take their blood sugar before they eat, it's going to be above 99 if they're out of control. But I've seen blood sugars as high as 500.
Wow.
Fasting.
Wow.
Yes. Yes, because I had to send a client I was working in home health, and he was 500, and he refused to go to the emergency room. Because remember, we have to give them insulin. Insulin is what's going to bring the blood glucose down. So if a client has a blood glucose, fasting blood glucose over 100 or 200, usually they're going to be on some kind of anti-diabetic medication, whether it's oral or insulin. Okay, complications of diabetes. So we know one of the biggest complications is the second one, because we see so many dialysis clinics popping up all over.
Yeah.
This is a complication of diabetes, including hypertension and high cholesterol. So heart disease, eye disease, people lose their vision and hearing from having elevated blood glucose. Gum disease, peripheral vascular disease. Does anybody know anybody that lost a toe, lost a foot, lost a whole leg due to diabetes? It's because of poor circulation. Because those arteries are hardening with those elevated blood glucose levels, and it causes poor circulation, so blood can't perfuse those toes. Blood can't get to those extremities. So if they get a cut or a bruise, that's why a lot of diabetics should be inspecting their toes, their feet, every single day. Because if there comes a problem comes up and they ignore it and don't know, it'll develop into a foot ulcer, which, like we said, poor wound healing is a sign and symptom of diabetes. Neuropathy is a complication, so there's numbness and tingling in the toes and feet, stroke, and then diabetic ketoacidosis. So that's going to be somebody who has blood sugar of 800 and they're in like a coma state. That's an immediate trip to the hospital. So blood glucose and food. So most of blood glucose is going to be affected by any food you eat. Like Mom was saying, if they eat high carbs or a lot of sugars that they shouldn't eat, but any food is going to make your blood glucose elevate. But there are simple sugars that we should avoid because they increase your blood sugar more. Fats and calories. So people who are diabetic, including us, we need to make sure we're eating a balanced diet and drinking water. Instead of drinking soda and fruity drinks, we should be drinking water and low or no calorie drinks. Hypertension. Anybody in the audience diagnosed with hypertension?
Oh, yeah.
Yes.
High blood pressure.
High blood pressure. What about high cholesterol? Mine is on the edge. Yeah. Mine on the edge too. Yeah. So, high blood pressure and high cholesterol, it's hereditary.
It is hereditary.
Yes. So it's hard for us to escape it as black people in this country. It's called the cultural comorbidity because we have family histories of hypertension. I mean, just think about it. The slave trade and all of that still affects us physically. It really does. Hypertension, let's go to the next slide. I'm going to explain what hypertension is. So that is the high blood pressure occurs when the force of blood flowing through your blood vessels is consistently too high. So that's why it causes hypertension. So the blood that's flowing through your arteries, and when that heart contracts, and the force of the blood to the arteries is what we're measuring when we measure blood pressure. So the difference between hypertension and high blood pressure. What is the difference? So know your numbers. So in the video he talked about we have to make sure we're monitoring our blood pressure. So I did bring a blood pressure cup today to do blood pressure screenings after the presentation. So know your numbers. He also talked about hypertension being the silent killer, remember? So people can be walking around with blood pressures way over normal and not even know it. But some people have problems, like if somebody developed back pain, shortness of breath, numbness, weakness, change in vision, or difficulty speaking, we know that's a sign of a stroke, and that can be due to high blood pressure. Okay, so normal blood pressure, the video talked about is the systolic and the diastolic pressure, 120/80, so we go to the next slide. Weight is also going to make a difference, right? So if you're overweight, then high blood pressure is going to be eventually a concern. Okay. You're going to eventually have an issue with your blood pressure. So I got all of this information from the American Heart Association, right? They said that we have to try to lose at least 5% of our body weight to help support or lower or prevent high blood pressure. So if you're not diagnosed with high blood pressure yet and you're overweight, try to lose at least 5% of your body weight. And it is so hard to do. Because I'm trying, but I've been told today that I look like I lost weight. I have been working out. I have. Me, Toya, we've been working out.
Yep,
We've been working out. We
are
are trying. So it's supported numbers. When you get the supported numbers, it really helps because we text each other every day. So we got motivation. Yeah, we gotta do it. High cholesterol. So your body naturally produces cholesterol. An unhealthy lifestyle makes your body produce more LDL, which is the bad cholesterol, right? So we need to know what our cholesterol numbers are. So behaviors that negatively affect your cholesterol levels are unhealthy diet. So those steaks that we like to eat, eggs carry a lot of cholesterol, so that's why they say the yolks. So maybe discard the yolks and eat the egg whites. Smoking, if you do, like the video said, please stop. You do not want to smoke. Today. Yes. Being overweight is also a risk. Being obese, and then hereditary, like we talked about. So complications of hypertension and high cholesterol, kidney disease, end-stage renal disease, like I talked about, and heart disease, because I talked about the congestive heart failure. That's if people are not taking their medications. That's going to be the essential. See your doctor. If they prescribe medications, take them every single day. I think that'd be a part of the problem with us is sometimes we think that we can get over hypertension ourselves. You have to be under a doctor's care. Don't just stop taking the medication because you feel better. You gotta keep taking it, be under a doctor's care if you want to eventually be off of them, like I do. I want to be off of hypertension medication, but we have to be under a doctor's care to do that and make some modifications to our life. So to reduce cholesterol, I have some recipes in the back that you can get. One of the recipes, because one of the foods that we like to eat that has high cholesterol is bacon and sausage, especially pork. Pork, bacon, pork sausage. How many like pork bacon? Raise your hand. But you know what? Everything in moderation. If you know you're going to be sitting around a lot and not moving, you shouldn't be eating it. You should not. So the recommendation is more fish, eat less meat, less red meat. If you're going to eat the red meat, trim the fat and eat smaller portions. Choose white meat of the chicken because that dark meat like that I love, legs and thighs, is we have to reduce our amount of fat. Because
Short that.
I already talked about bacon, sausage, cold cuts. Processed meats just have a lot of fat. Too much fat. And salt. Thank you, Mom. Salt. Broil over pan frying and then increase your grain intake. Increase your grain intake. So, grains, oatmeal, wheat, bulgur,
Brown rice.
couscous, quinoa, yes, oats, any kind of oats. Yes. Steel cut oats. Eat more grains. Grains will help balance out and reduce the cholesterol. Like Cheerios, they have a big campaign that reduces cholesterol. So just eat more grains. Okay, so I'm talking about the signs of heart attack. And that's chest pain. So one of the signs of heart attack, reasons why people develop heart attack is, like I said, a journey in their lives where they're sedentary lifestyle, mostly stressful jobs, and our diet if they're smoking, and then eating what we should be eating. So a late sign, a late problem, it means that you've been doing this for years, heart attack can develop. Chest discomfort. And other areas of the body like pain in the neck, jaw, stomach, arm, shortness of breath, cold sweats, or even pass out. Some people pass out, lightheadedness, pass out, and they have to be resuscitated. So this QR code will show you like an image and information about signs of heart attack. I think we all need to know this because anybody can be at risk. I've heard pastors have heart attacks during talking to the congregation. I think it happened to T.D. Jakes.
Yeah.
Yeah, while he was in front of thousands of people. So heart attacks can happen anywhere and any time. And what you do when somebody has these signs and start complaining or pass out, just call 911. That's what we do. Call 911. And then we might need an AED. Those are important to have. It helps extend the life of the patient until now the EMS gets here. Signs of a stroke. So face drooping, arm weakness, speech difficulty. Call 911. Prevention. How to eat better. So I have some information on the back tables. You use this QR code and it'll give you more information on how you can eat better. It gives you the steps, what to do, what foods to choose. Watch what you eat. So Mom talked about salt. Adults should have 2,300 milligrams. That's a teaspoon of salt a day. So just imagine the chips we eat, the bread, the crackers. And we didn't even add anything to food. Processed food has so much salt. That frozen food, canned food. and it has increased. Salt alternatives like Mrs. Dash and just seasoning. Some people make special seasoning that make food taste just as good as if you add salt. So I didn't bring any examples, but this website that I use, they have hundreds of different things that you can use and resources and information about it. The only thing I want to say about this sodium thing is we really need to avoid processed food. Like I was saying, a nutritionist, and they said we really need to shop on the outskirts of the store. So when you first walk in, usually it's going to be the dairy department or the fruits and vegetables. So everything in the middle, we need to avoid it. Because it's filled with salt. Processed food. Yeah.
When you go past the vegetables, you got all that processed food right there.
Exactly. Exactly. So dairy, low fat dairy. If we're going to choose dairy, low fat, lean meats, lean poultry, fish like we talked about, and then the non-tropical oils or like avocado oil, olive oil, and not those saturated fats like lard. In the past, we used to eat lard. I could put a lot of lard. So avoid processed food. That's going to be really hard because being a busy parent, I used to grab those hamburger helpers and put some it's fast food.
Right.
And it's cheap.
Right.
And you give it to the kids. But we should not be eating it. We should not be eating it. We really need not to be giving it to our children either. We want to develop healthy habits and teach them as well. So fruits and vegetables, eat plenty of those. Emphasize variety, so all the different colors. Beets, how many people like beets in it? I love beets. A lot of people don't like beets. They got to be pickled beets. So eat a variety of fruits and vegetables and no alcohol. Just avoid it. Avoid because it causes high blood pressure. When we look at all of those different diseases and complications that the body could develop, prevention is going to be that we eat right and move our bodies and make sure we see our providers regularly, right? And then if you're on medications, to just take them, okay? And monitor your blood pressure and the numbers. Monitor the numbers. So regular exercise, we got to get moving. I used to sit in front, after I get off work, because you'd be exhausted. So after you get off work, you sit, and I used to watch the clues or the news, right? I used to watch the news. That was my routine every day. The clues, yeah, because they don't tell you.
That's right, clues.
So I used to just sit there, and then I started thinking, I need to be moving. Even though I'm tired. Go take a walk. Now I start walking the dog. I started a water aerobics class at 5 o'clock. So move. But I started having more energy. Now I don't just go home and sit down. I might go cook. I might go take a dog for. Now I have more energy. It increases your energy the more you exercise. And that's okay. Yeah. Like you thinking, okay, I'm coming home and I'm just going to rest. I'm tired. Because we be tired. We be so tired. We do. We be tired. You do. Yeah. But you gotta get up. You gotta make yourself. Yeah. You gotta make yourself. Just like we talk about when we fighting the enemy. You gotta make yourself speak your spiritual language. Yeah. So you can fight the enemy. Right? Yeah. Same thing with our bodies. We gotta make ourselves. We gotta fight that lazy spirit.